As the virus mutates to become more transmissible, we must respond by testing more widely. We already do rostered routine testing, RRTs, in a number of higher risk settings: migrant worker dormitories, construction work sites, shipyards, air and sea ports, hospitals, and nursing homes. With faster, cheaper tests, we can do routine testing at more workplaces, like offices, restaurants, and shopping malls. We can also routinely test individuals whose occupations involve close contact with many people and could result in super-spreading events, like taxi drivers and bus captains, physiotherapists and masseurs, stage performers, sports and fitness instructors, and educators. All could be tested regularly. This will reassure their customers, patients, and students, and enable them to work safely, even with COVID-19 in circulation. In short, we are shifting our approach to testing. Henceforth, we will not only test to identify infections when a new case pops up. We will also routinely and regularly test people who appear well in normal work or social or community settings to make them and these places safe. Extensive testing will give us confidence to resume larger scale events or gatherings. For example, we can deploy fast and easy tests before a religious service, a football game, a concert, or a wedding reception, and participants can be assured that the event is COVID-19 safe. Therefore, you should expect routine, large-scale, fast and simple testing to be part of our new normal. Second, we will contact trace faster and more widely. Our contact tracing operations have vastly improved. The contact tracers are working faster and better because they have more experience and skills and better tools. Trace Together helps them identify and quarantine close contacts of an infected case within hours rather than days. With Safe Entry, they can identify thousands of people who had visited the same places as infected cases and inform all these potential contacts to come forward for a free COVID-19 test. This is what we did for White Sands, GEM, Westgate, and now NTUC Food Fair in Anchorvale. Because of Singaporean self-discipline, public spirit, and support of Trace Together and Safe Entry, we are contact tracing faster and more comprehensively. We can improve our contact tracing further by casting the net wider. Our experience has shown that if a close contact is infected, he is quite likely to infect others who stay with him in the same household. Therefore, in future, when we identify a close contact of an infected case, we will not only isolate him himself, the first-degree contact, and test him for COVID-19. We will also notify his household members to isolate themselves immediately without waiting to see whether the first-degree contact tests positive. If later the first-degree contact tests negative, we can safely release his household members from isolation. But if later the first-degree contact tests positive, we will have saved precious time by isolating his household members earlier. This more aggressive approach will help us to shut down clusters more quickly and with fewer cases. Third, we will vaccinate more people and faster. We've made good progress since vaccination started in December. Our healthcare and frontline workers, and the majority of those 45 and above, have already received at least their first dose. These are the ones more at risk from COVID-19. Now, vaccination of those aged 40 to 44 is underway. The MTF recently announced that we would speed up vaccinations in the next 2 months and prioritize first dose vaccinations. This is in progress. We want to protect as many Singaporeans as possible as soon as we can, especially with the new COVID-19 variants. This approach will quickly provide the maximum number of people with good protection, instead of a good number of people with maximum protection. We are vaccinating as many people as our supplies allow. Our 40 vaccination centers island-wide are running smoothly. The constraint is vaccine supply. This is why we've been working very hard to confirm and speed up deliveries of vaccines from our suppliers. I'm happy to report that since the last update by the MTF, we've received further confirmation of faster vaccine deliveries over the next 2 months. With the latest supply schedule,